If you're watching this, you most likely have been through the peripheral neuropathy evaluation and you're interested to find out your results. So also you likely have the results in your hand. So you'll have a paper that looks like this graphic on the bottom here, and that'll be specific to you. If you have this handout, it's an example one, but you'll also have your own results. And as you follow along the video, you can look at how your results, what they mean. So in this video, we'll help you understand how to interpret your results and learn how we determine the severity and prognosis for your specific case. So first we'll explain the severity, which is the grade of how much the nerves are damaged. Then we'll explain the various factors, we call them multipliers, that influence the rate and amount of possible recovery. And finally, we'll explain how we put that information together for a prognosis, which is what amount of recovery we expect and how long it will take. So most recovery takes 60 to 90 days to begin measuring significant improvements. We love to see improvements before that, but we don't expect it in any big way. So many cases continue to improve for a year if healthy lifestyle changes are made in addition to the direct treatment that we provide in the office. So interpreting your results. There are individual scores, sensory scores, and prognosis multipliers that are used to determine your severity and prognosis. So this is a look behind the curtain of how we determine the probability and difficulty of your recovery. This is not a perfect science, but it does give you and us a good idea of what it will take to reach at least 25% recovery. Now 25% is the bare minimum goal. We expect to reach 30 to 50% or more recovery when you do a good job of following our recommendations. The individual scores on the neuropathy severity graphic. So the color indicates the level of sensory nerve function remaining. The 0 does not mean all sensation is lost. It means that you cannot feel a 10-gram pressure. Research has shown a clear risk for tissue damage and infection in that category. So as you look at your scores, they will reveal the sensory nerve damage and risk. As your nerves heal, we especially celebrate scores moving out of the 0 to 2 range, which buys you more time to heal while you're out of that critical risk zone. So we add all the individual scores together to determine the total touch score, which you'll see later. So look at your results. The diagram will show your individual scores, and the total touch score is listed as the number out of 300 possible. Now sometimes we may list a higher number possible if we include the hands also. All right, the scale for interpreting individual scores. 0 to 2 is black, purple, or dark blue. It's the risk zone for this. It's high risk for infection, poor wound healing, and nerve damage progression. So look on your graphic and see which parts of your body fall into that category. Treatment success need for that level, it's critical in order to prevent probable infection and serious complications. Time required, recovery will take the most time. Cause identification and correction need is critical to support healing. All right, the next is 3 to 5, green, red, orange. The risk zone for this is moderate risk for infection and poor wound healing and high risk for nerve damage progression. Treatment success need is also high in order to prevent probable infection and serious complications. Time required, recovery will take a moderate to long time. Cause identification and correction need, moderate to high to support healing. Our next is 6 to 8, which is yellow and light blue. The risk zone, there's some risk for infection, poor wound healing, and nerve damage progression. There's a high risk for nerve damage progression if the cause is not identified and corrected. And treatment success need is moderate in order to prevent progression into the higher risk zones. Time required for recovery will take less time, and the importance of identifying the cause and correcting it is high to support healing. Next, the final one is 9 to 10. This is the clear, there's no color. If symptoms are new, if you're having symptoms in this area and they're new, then we want to reevaluate in 3 months or so. And if your symptoms are old, then we'll reevaluate in 6 to 12 months. And if you have symptoms in that area, but there's no nerve sensory loss, then we want to find the other cause for your symptoms. All right, next, the total touch score. Your total sensory score, total touch score, gives you an idea of how far the neurological damage has progressed. As you heal, this is a sensitive score to mark your sensory recovery. The maximum score is 300 for the legs and 380 for the legs plus the hands. The prognosis multipliers increase the resistance to recovery. Several conditions or habits will worsen your prognosis, meaning that they will undermine your recovery, making it more difficult. An added resistance of 1 increases your needed treatment level by 2 levels. You'll see that on the chart further down. I'll show you that. That will look like this toward the last end of the page. But don't worry about that. That's a little more complicated. Okay, so these conditions, the impact they have on recovery and the steps you take to improve your odds of significant recovery are listed in the prognosis multiplier chart. In addition to the effect on your neuropathy, if you have diabetes, it's important to recognize that your feet and hands are just the first of the body parts to lose noticeable function. The heart, kidney, brains, they're already being damaged as well, but they may not have reached a point of obvious function loss. The problem is those tissues are harder or impossible to restore sometimes than are the nerves of the hands and feet. Now, I want this revelation to inspire you to pursue the deeper solutions that promote healing for your entire body and brain. Another example, if gluten neuropathy is the cause of your peripheral neuropathy, we know that immune reactions to gluten may also cause brain tissue damage in the cerebellum, it's part of your brain, or in the skin, or the gut, or the thyroid. If gluten is the cause, each bite of gluten may cause another permanent bite out of your brain or your thyroid, in addition to the damage to the nerves of your feet and hands. So if nutritional deficiency, diabetes, or gluten intolerance is the cause, we would categorize these as systemic chemical causes. Diabetes and smoking get their own rating since they're so clear and common, and unknown causes usually fit this category as well. So intensive treatment of systemic chemical causes will likely reverse some of the damage, but if the toxic environment inside your body persists, it will recreate the damage, reversing the healing. So unless you change your exposure, it will be a constant effort to maintain recovery. Nutritional deficiency often cannot be known without further lab testing, especially functional medicine lab testing that measures your digestion, absorption, and utilization of specific nutrients. So we often recommend this. The last 2 multipliers, compression and subluxation, require more examination to determine if they're present and if they can be helped. Sometimes their treatment is optional, sometimes necessary to make progress in healing the neuropathy. Now, part 2 of the exam will give findings to provide those answers. So reducing your multipliers. Reducing your multipliers will increase your ability to heal. This is a great advantage to you. Sometimes it will be the difference between healing or getting worse, leading to infections and other health complications. So those health complications may include toe and feet infections and amputations, but they also may include earlier onset of dementia, heart attacks, kidney disease, and simply less active and independent lifestyle. So let us know if you are highly motivated to reduce your multipliers so that we can support you as needed and take this lifestyle improvement into consideration as we make up your treatment recommendations. Now, treatment and testing recommendations. So consider this: nerves regrow at 1 millimeter a day. All right, so that's a centimeter. That's a centimeter. A millimeter is 1/10 of that. All right, so your nerves regrow that far in a day. That's not very much. If you understand that some of these nerves, right, begin from your lower back and go all the way down to your leg. All right. So hopefully they haven't died back that far. It's going to take a long time. And they grow about 1 inch a month. Some nerves to muscles may never regrow. It's important to know that as you go from numbness to more normal sensation, there could be added discomfort in some areas as you transition to more normal tissue health. As you know, the danger of no sensation is you don't feel the pain of a cut or the itch or pain of an infection. Not knowing allows the damage to progress. That irritation, that itch or that pain could save your life as it brings attention to the tissue's need for medical care. But we also expect more comfort as the brain starts receiving signals from the tissues that were dead to sensation. In this renewed sensation scenario, the brain no longer needs to send warning signals to bring attention to the unexpected disappearance of sensation. So, as tissues and nerves heal, you will go through various transitions of sensations that are not always predictable. But it always gets better as the tissues and nerves heal enough to both reduce the tissue damage and increase the brain awareness. All right, what about the treatment? In-office treatment. Think of your feet or hands as a plant. The soil is hardened, poor drainage, parched at times, and spoiling with stagnation at others, and always void of life-giving nutrients. It's no wonder the plant has weak, dying leaves and withered, rotting roots. The in-office treatment is the intensive phase of restoring that soil, making a healthy environment for nourishing regrowth. Each in-office session will typically include laser on the tibial and peroneal nerves, and then we also may do it on the lumbar spine, which is where the nerves begin. Number 2, high energy LED on feet and hands. This is such high energy, we only do it for 40 seconds approximately at each site. And then at home, you'll do it for about a minute at each site. And number 3, the rebuilder nerve activation or exerciser of sensory nerves. These sensory nerves naturally inhibit pain, so we want to exercise them. Number 4, percussor. We use this as a way of activating the large sensory nerves in your feet and getting more blood flow. Number 5, we often use a heating pad to lay over the top of the foot, increasing blood flow and comfort. And number 6, chiropractic spinal treatment. And this is something we'll determine from the exam whether this needs to be done or not. Home treatment. We provide a high-power red light energy for your home use for you to keep. The reason is that although not as powerful as what we do in office, it's a very helpful way to maintain improvements, continuing that tissue nourishment along with your healthy eating and exercise habits. The more prognosis multipliers that are present, the less likely the home treatment will be enough to maintain your improvement, and the more likely you'll require booster sessions. We recommend the brief in-home therapy be done at least once per day, but 2 to 3 times a day usually works even better. Reevaluations. In the early stages of recovery, we will reevaluate your neuropathy approximately every 30 days. So what about those booster sessions? Well, we can better make recommendations on these after we see how well you improve with the baseline treatment. The remainder of this information in this video gets more complicated and is unnecessary for you to understand. But if you'd like to know all the details behind the recommendations, continue along. So the chart on this next page is based on the latest scientific discoveries and our clinical experience. And it's mostly how we determine your treatment duration. So at this point, I know you likely have a good understanding of the seriousness of your condition and your health habits. So please also understand that we have hope for you based on our experience with other people that have been in your situation. So yes, there's a hard road of recovery ahead, but it is also a road filled with hope and healing and the positive experiences of many that have traveled this road before you. So you may stop the video now and find one of our assistants to discuss your scheduling and payment options. Or if you'd like to continue for more details, you're welcome to continue. So how do we calculate the recommendations based on your results? So the number of sessions required. The number of in-office sessions is found in the prognosis and treatment number and the duration chart. That will look something like this. Okay, and this is determined from your total touch score and prognosis multipliers as listed in that chart. For example, if you have a total touch score of 200, the treatment level would be here. Oh, sorry, here, and that would be a level 2. And then if you have a prognosis multiplier of 1.5, so we go from here and we go up 1.5, that would take us to 3.5, right? 2 plus 1.5 is 3.5. Now the baseline sessions for that is a typical estimate. Baseline sessions is over here. That's a typical estimate of the number of treatment sessions required to get greater than 25% improvement in the sensory recovery on repeat evaluations. So with that sensory recovery, we also expect at least that much reduction in pain, tingling, burning, excess sensitivity. And we say 25%, but we usually expect 35 to 50% recovery. All right, what about the weeks in office? It's approximately 1/2 of the session number, since the in-office treatment is 2 times per week, based on coming 2 times per week for the in-office treatment. What about the home therapy? So home therapy weeks for 25% recovery is how long it typically takes to reach more than 25% recovery and hopefully 50% recovery. And of course, this is considerably longer than the in-office treatment that gets your tissues nourished well enough to begin really restoring themselves.